Hello, everybody. Welcome back to another episode of Radiology. Today we're on Radiology number 32. And if you remember from last episode, we're going to continue discussing the different types of drugs that are kind of used in patient treatments, surgeries, post procedures, pre ops, and etc. And these are mainly from my own experiences in the ICU, and it could differ depending on the preferences of each hospital and what drug they kind of want to promote, but I'm just kind of listing the different experiences that I've had with what these drugs do and all that. So let's get into it. Just like always, we're going to have this quick reminder. Now, since we're talking about mostly drugs, this isn't going to be compatible with what we're really talking about. However, in the end, once we're done kind of combining all these different drugs, learning about them, I'm going to present you guys with kind of like a case scenario or like study and kind of show you guys how these drugs can be used simultaneously to help alleviate patient conditions as well as help during post-op procedures and show how x-rays can be connected to this, in not directly obviously, but kind of used to identify different levels of like procedure needed, whether it's a pleural effusion or whatnot, and you can kind of focus in on specific medications to treat that. So we'll explore that in a little bit. So the medication we're talking about today is going to be called midazolam, or it could also be called as Versed, and that's mostly the store, like the brand name. And kind of like propofol, it's used to provide a sedative measure, so alleviate pain and stress relief after a surgery. However, the only problem with Versed is that it caused a sense of delirium, and it causes people to have this abnormal demented state where they may be absent in their thoughts, have confusion, memory loss, they may even have some nausea. And it also contributes to low blood pressure, which particularly isn't good because you kind of need a higher blood pressure for some of these IV medications to work because they're going through your blood. And if you have a lower blood pressure, what happens is that these medications aren't administered as effectively. And arguably, one of the more important side effects is going to be a decrease in your respiratory rate. Now, what this means is you're kind of taking more shallow breaths. And as you get more and more used to Versed, your body is going to have trouble trying to maintain the new respiratory norm. And that's kind of the problem with Versed. It kind of forces the body to learn how to adapt because it puts the body in such like a stress-like behavior for such a long time. And yeah, that's kind of the end of the Versed. And we'll talk about another drug tomorrow. Hope you guys have a good one, and I'll see you on the next one. Bye bye.